Now, this guy is generally done. You can do it one of two places. Most of the time, this is where you're going to do it, and that's right in the upper outer quadrant of a butt cheek here. Now, you can do it, and I'm going to have my little model turn around here for a minute. You can do it in your upper thigh. This is all muscle right here too. And a lot of gals who are stuck doing the injections themselves will ask me, can I just do it here? Well, you can, sure. And usually I would just have you use maybe a 1-inch needle because there's not as much tissue here generally between here and the muscle. But I will tell you, this hurts a lot more. So you can do it. It's fine with me. Most people choose not to do it, or if they do it once and they never do it again, just because it is pretty sensitive right here. So again, most folks are going to choose to do it right back here. Now, easy enough thing for me to tell you to do is there are really only 2 parameters to do this injection. And I'll tell you, most often when I have folks that maybe they've been on this shot for a few days or a week, and they'll tell me, this is terrible. It's horrible. I can't do it anymore. I'll tell them, come on in, let me take a look. They're usually still in cycle with me and I can see them. And invariably I'll find the position is wrong. That's all. Now, not wrong for me per se, because quite honestly, this is all muscle back here. So you're getting your medication, but invariably it's in the wrong spot, and that's why it's hurting so much. Usually it's hurting after. Here's your 2 parameters on what you want to do this injection. 1, I want you to stay above the top of the butt crack. So wherever we see that little butt crack, draw a little imaginary line here. Parameter number 2, I want you to stay in the outer half of the cheek. So we're just kind of splitting the cheek in half, which means we're really just about there where my fingers are, right about in that spot there. When I have folks come in and tell me, oh, it's terrible, I can't stand it, I'll find shots, I'll see the marks, they're all over down here. They're getting it down here in their poor little butt cheek, which is where they're doing all their bending, all their sitting, and it hurts. It's not a great shot, certainly, but this is not nearly as bad. This makes all the difference in the world, getting it in the right spot, okay? So this is our spot. So again, we can move around here and rotate. Now, to do this injection is literally the opposite of what we've been doing. Now, we've been pinching up tissue because I'm trying to get the medication in the fat. This is an intramuscular injection, so I'm trying to get medication in the muscle. So I'm going to do the opposite here. Now, of course, I'm going to get a little alcohol swab and I'm going to clean the skin here. But instead of pinching up, you're going to find I'm going to do this. I'm going to kind of press down and make that taut. I'm trying to flatten out any fat she has right there. So I'm going to make that nice and taut. And again, my preference would be that patient would be laying down. And I'm all business about this. I've seen different techniques, and there is no right or wrong, but my experience has been just be all business about this. Yes, basically the needle goes all the way in. And kind of like a dart at a dartboard, you're just going to all the way in. Now, one of the tricks we have to do here, because this is a deeper injection, you've got to aspirate and just make sure you're not hitting a little blood vessel, a little capillary or something. So once the needle's in, you can let go. And what you're going to do is you're just going to pull up ever so slightly on this plunger. And I'm just going to pull up a little bit. And when I do that, 99 out of 100 times, I'm going to see what I just saw there, a little air bubble. And I know I'm going to be perfectly fine to do that injection. Now, I don't even know if in my 14 years I might have seen this once, but sometimes if you were to ever see a little bit of blood come back out, that just means you must have hit a little capillary, no big deal, but I wouldn't necessarily want to do the shot right there. So I would just pull that out. I'd probably get myself a whole new setup and just maybe move to the other side and do the injection. Otherwise, like I said, when you're doing the injection, you're just going to, for me, I use just the weight of the resistance of the medication to do the shot. Now, afterwards, I like to do a little massage. Try to spread that medication out a little bit and just do a little massage there. And now, again, for comfort, I have some folks who, probably most folks, go ahead and they rotate. They go back and forth and back and forth. I have other folks who really want to sleep on one side of their hip and not be sore. So maybe they choose to do all their shots over here so they can sleep comfortably over here. Doesn't matter to me. Whatever works for you, certainly. Some individuals have to try to do this shot by themselves, and it's tough. If you can reach around and, you can manipulate it yourself, usually you have to stand and look in a mirror and do it, and that's okay too. Every now and then I do get requests, do I have to use a 1.5-inch needle? Can I use a 1-inch needle? I do use a 1-inch needle on my really small patients. But remember, I need this to get into the deep tissue, so it doesn't serve our purpose to try to make things easier for you sometimes. But again, for those gals who are, 105 pounds and just little tiny things, a 1-inch needle is acceptable to do. And that is an intramuscular injection.